This video presents examination of the peripheral vascular system, including the arteries, veins, and lymph nodes in the arms and legs. In this video, the examiner will assess a healthy patient. Keep in mind that other patients may have the same normal findings or may exhibit normal variations or abnormal findings. Begin by inspecting both arms from the fingertips to the shoulders.
And turn them over.
Note areas of edema, discoloration, rashes, scars, and changes in skin texture. None are seen here. Also note hair distribution and venous patterns. Assess the skin temperature of the hands and lower arms with the sensitive backs of your fingers, comparing both sides. If you detect unusual coolness or temperature differences, check further up the arms. Next, palpate the radial pulses and compare their amplitudes. If you suspect arterial insufficiency in an arm or hand, feel for the ulnar pulse. The pulse of a normal ulnar artery may not be palpable. To help determine the patency of the ulnar artery, perform the Allen test. Place your thumbs lightly over the radial and ulnar arteries and tell the patient to clench his fist tightly. Then firmly compress both arteries between your thumbs and fingers.
Open your hand.
Have the patient open and relax his hand. Note the color of his palms and fingers, which should be pale. Then release the pressure over the ulnar artery. If the artery is patent, the palm should turn pink in 3 to 5 seconds.
I'd like to repeat this test to check the other artery. Will you make a fist again, please?
To assess the patency of the radial artery when indicated,
open your hand.
Repeat these steps, but release the pressure over the radial artery. Next, assess the brachial pulse. Flex the patient's elbow slightly. Then, with the thumb of your opposite hand, palpate the pulse at the antecubital crease, just medial to the biceps tendon. Then try to feel the epitrochlear node. With the patient's elbow somewhat flexed and the forearms supported by your hand, feel in the groove between the biceps and triceps muscles about 3 centimeters above the medial epicondyle. If the epitrochlear node is palpable, note its size, consistency, and tenderness. Repeat on the other arm. Examination of the peripheral vascular system involves assessment of the arteries, veins, and lymph nodes in the arms and legs.